Hello, I'm Jamie Bonzik, the Executive Director of Hopkins Early Learning Center, an independent nonprofit serving the West Metro. There's growing concern about the impact of COVID-19 on the childcare industry and the need to save childcare to save the economy. I share these concerns and am gravely concerned about what the lack of a larger public investment will mean for my program and childcare as a whole. As a pioneer in high-quality early childhood education and care, we were one of the first NACCE-accredited centers in Minnesota and part of the Parent Aware pilot program. 50% of our staff have been in the field of early childhood education and care for over 20 years, with most spending their entire career here at HELC. But despite all our success, we are on the verge of losing everything. Before COVID-19, HELC was full with a wait list. We hold 117 licensed childcare slots in the West Metro. Finding educators who specialize in infant and toddler care is hard, which means that there are less spots available. At HELC, over 50% of our programming is dedicated to infants and toddlers. When I used to walk into the HELC environments, I marveled at the wonder, the energy, and the humor. And then we, like all other early childhood education and care programs in the state, were impacted by COVID-19. We closed down completely for 2 weeks to create a response plan to information that was changing every hour. During that time, we paid our educators and did not charge our families tuition. We had already heard that many of our parents were getting furloughed and were not getting paid. When we decided to reopen in a limited capacity, we knew that we needed to provide predictable environments that were soothing and stimulating. We focused on the 3 R's: reassurance, routines, and regulation. But these best practices come at a cost. Currently, we are serving less than 20% of our 117 children. In childcare, tuition is directly tied to operating capital. Our revenue has greatly been reduced, while our fixed costs have remained the same and to some degree increased. Without the ability to stabilize our funding, we jeopardize the very foundation of what makes Hopkins Early Learning Center and programs like ours high quality. Our ability to recruit, retain, and compensate an incredibly qualified workforce, especially those working with our infants and toddlers. At Hopkins Early Learning Center, we believe that all children and families deserve access to educators who understand child development and have the skills to individualize lessons in our classrooms. Because of this, HELC has a mixed financial model that includes family pay, scholarships, and child care subsidy payments. At our current ratios, we would need to scholarship each child on subsidy an additional $184 per week in addition to the scholarship we are already providing. As an organization, we have spent time to put in many applications, yet Hopkins Early Learning Center has not been awarded any of the funding that we have applied for. Early childhood funding is a topic that is getting much coverage in the media, and I would like to see fiscal actions based on the recommendations that have been laid out. Specifically, I would like to see early childhood educators who have continued to work through this public health crisis receive heroes pay. And I would like to see city and state governments leverage their relationships with employers. I would like them to ask private businesses to help finance childcare for their employees and the communities in which they're doing business. And I would like to see our federal government invest in a system of childcare. Let's not miss the opportunity to create an infrastructure that creates more equitable access to early learning programs like Hopkins Early Learning Center. Thank you for your time, and invest in early childhood education and care, for it is now and will continue to be an essential service for communities and our economy.